Fugitive Facts Podcast, Hospital Series. Learn hospital hierarchy for better care when hospitalized.
I'm tired and I'm sleepy.
Hi, everybody. Welcome back to the Fugitive Facts Podcast. Today, we're going to be jumping into the often mysterious world of hospital hierarchy. First, let's break down the basic structure of a hospital's medical team, starting with attending physicians. These are the senior doctors who oversee your care. They have completed their residency and are fully licensed specialists. For example, if you're admitted for heart problems, your attending might be a cardiologist with years of experience. Then we jump over to fellows. These are the doctors who have completed residency and are pursuing additional specialized training. A cardiology fellow, for instance, might be focusing in on advanced heart failure management. Then we have the residents. These are the licensed doctors completing on-the-job training in a specific field. They're supervised by attending physicians. You might encounter a third-year internal medicine resident managing your day-to-day care. Let's take a look at the interns. These are the first-year residents fresh out of medical school. They're eager to learn and often handle tasks like taking your medical history or performing initial examinations. Last but not least, they're the medical students. They're still in training and aren't licensed to make medical decisions, but they might observe or assist with basic tasks. Now, here's a lesser-known fact. In teaching hospitals, you might be primarily seen by residents or interns, with the attending physician overseeing from afar. This isn't necessarily a bad thing. These doctors are often up to date on the latest treatments. However, if you're concerned, you have the right to request the attending physician. Now let's move on to nursing. I'll start with the nurse practitioners, better known as NPs, and physician assistants, better known as PAs. These professionals can diagnose conditions, prescribe medications, and often serve as your primary point of contact. They might manage your care plan or perform procedures like inserting central lines. The next person on your nursing staff is the registered nurse, better known as RNs. They provide direct patient care and your go-to for most immediate needs. RNs administer medications, monitor your condition, and coordinate with other team members. And we mustn't forget licensed practical nurses, better known as LPNs. They handle basic patient care under the supervision of the RNs, such as checking vital signs or changing dressings. Last but not least, we have our nursing assistants. They help with daily living activities like bathing, eating, and mobility, and sometimes they can even do your vital signs. Here's a tip. Nurses often have the most direct contact with patients. Building a good relationship with your nurses can significantly improve your hospital experience. They can be your best advocates and sources for information. Now let's talk about how you can use this knowledge to get better care. You need to know who's who. Don't be afraid to ask staff members about their roles. Understanding who you're talking to can help you direct your questions appropriately. For example, if you have a question about your medication side effects, your nurse or pharmacist might be the best person to ask. You always want to communicate effectively. If you're not getting the answers you need from a resident or a nurse, politely ask to speak with the attending physician or even the charge nurse. It's your right to understand your care fully. Be proactive. If you're in a teaching hospital and prefer to be seen primarily by the attending physician, make this request known early in your stay. However, remember that residents and fellows can often spend more time with you and be excellent sources of care and information. Utilize the chain of command. If you have concerns about your care, start with your nurse. If the issue isn't resolved, ask to speak with the charge nurse, then the nurse manager, and so on up the chain. Don't be afraid to escalate if you feel your concerns are not being addressed. Here's a little known fact. There's also the power of the hospitalist. These are doctors who specialize in the care of hospitalized patients. They often have a broad understanding of hospital systems and can be great advocates for your care. If you're admitted through the ER, you might be assigned a hospitalist who will coordinate your care throughout your stay. And of course, we don't want to forget about our ancillary staff. Those are the physical therapists, respiratory therapists, and dietitians who are all part of your care team. Their input can be invaluable. For instance, a respiratory therapist can provide crucial support if you're having difficulty breathing, while a dietitian can ensure you're getting proper nutrition for your condition. Here's another tip. Understand shift changes. Hospitals operate on a 24/7, which means staff changes. During shift changes, important information about your care is passed on. Don't hesitate to repeat important information or concerns to a new staff member. Lastly, here's a lesser-known fact that might surprise you. The patient, that's you, is at the top of the hospital hierarchy. You have the right to be involved in decisions about your care, to ask questions, and to advocate for yourself. This includes the right to refuse treatments or request second opinions. Now remember, understanding hospital hierarchy isn't about being demanding or difficult. It's about being an informed patient who can effectively navigate the system to ensure the best possible care. By knowing the roles of different staff members and how to communicate effectively with each, you're setting yourself up for a better hospital experience. Thanks again for joining us on this episode of Fugitive Facts. If you found this helpful, please share it with your friends and family. Don't forget to subscribe for more insightful episodes. Stay curious, stay informed, and keep seeking the truth. Your health may depend upon it.